So today we're going to be talking a little bit about seasonal allergies. And as always, the disclaimer that the information that we're providing today is just to increase your awareness. It's not intended to be medical advice. If you feel that you have questions or concerns or have conditions that you would like to discuss with your doctor, please do so. Again, this is just supposed to be to increase your awareness. Okay, so I want to thank you all for joining today's Wellness Wednesday. As I mentioned, the topic is seasonal allergies, which seems very timely for this time of year. We're hoping to be able to gain a better understanding of what seasonal allergies are, some of the symptoms, causes, and common prevention and treatment methods as we go through some of these slides. So let's start at the very top and discuss what are seasonal allergies. So basically, it's your immune system's overreaction to environmental substances, and they're caused by a powdery substance made by certain plants, aka pollen. And pollen is generally harmless, but if you have seasonal allergies, your body mistakes it for something dangerous. And so then your body's reaction or your response to an allergic reaction would begin in the immune system. So, when a harmless substance, such as pollen, is encountered by a person who is allergic to that substance, the immune system may overreact by producing antibodies to then attack it. And these chemicals eventually spread to tissues in the eyes, the nose, the throat, and the lungs. And it can cause, wheezing, itchy, watery eyes, runny nose, and other symptoms. And then too much pollen exposure can actually cause the immune system to go haywire and trigger those allergy symptoms. Now, I'm sure if you join this, you probably either know somebody or have allergies yourself. So let's talk a little bit about the prevalence. Allergies are quite common, especially nowadays, and there are a couple reasons that this could be. It could be partly due to higher standards of hygiene and the fact that some infections have become less common in childhood. So then, as a result, our immune systems are often not as well trained, so to speak, as they might have been in the past. Another factor could be allergies often run in families. So if your parents or your siblings have allergies, you're more likely to have them as well. And then, kind of a fun fact I like to throw in here too is, well, maybe not a fun fact, but if you suffer from pollen allergies, your mouth or throat may become itchy after eating celery or apples. This happens in actually 50 to 75% of adults allergic to birch tree pollen. And this reaction is due to proteins found in some fruits and veggies that are very similar to those in pollen. So then the immune system becomes kind of confused on which causes an allergic reaction or could make existing symptoms worse. It's known as cross-reactivity. In the case of pollen and foods, the result of cross-reactivity is called oral allergy syndrome. And it's also called pollen food allergy syndrome. So next, I know we only have the Q&A feature in this presentation, but if you'd like to share some of the symptoms that you're experiencing as I'm going over the next slide, you don't have to, but if you're interested in sharing some of the symptoms that you experience, please feel free to do so. So some common symptoms, I won't read through all of these as I'm sure a lot of us are familiar, but this can really vary based on person. Some people may experience one or two of these symptoms, while other people may experience most of these symptoms. And also the time of year can vary as well, but typically seasonal allergy symptoms are experienced from March to October. Okay, and then next we'll go over, how to differentiate between seasonal allergies or the common cold. So as we know, a lot of these symptoms can be very similar, but there are a few differences to keep an eye out and it's important to keep an eye out for those differences because that can determine how you treat. So for colds, flus, and allergies all alike, they affect our respiratory system, which can make it difficult to breathe. So it is kind of important to know which one you're trying to treat. So for allergies, they can cause itchy, watery eyes, which you don't normally have with a cold or a flu. Allergies typically do not cause a sore throat, which is common in a cold. And then allergy symptoms typically last a lot longer. They last as long as you're exposed to the allergen, and that could be about 6 weeks during peak pollen time during the spring, summer, or fall. And on the flip side of that, colds and flus rarely last beyond 2 weeks. So these are some kind of cues that you can use, or clues, I should say, that might help you determine if you're fighting seasonal allergies or if you're fighting a cold. And of course, talking with your doctor may help you to figure out what the next course of action is. I wanted to share this as well, some peak seasons for trees, grasses, and weeds. And just something to call out here is, as you see for the trees, for hazel and alder trees, the pollen can actually be on the rise from February or March. I know it says there April to May, but it actually can be a little bit earlier than that, which is maybe not a good thing. But yeah, just keep that in mind for the hazel and the alder trees. And then also all of these pollens are native to Pennsylvania. All right, so let's talk about getting diagnosed with having allergies. So if you see a doctor or an allergist, they will ask you, what your symptoms are, what your everyday life circumstances are, and your medical history. And then they will do, or they may do a skin prick test, a blood test, or something known as a provocation test to determine if you have allergies. Okay, and jumping into prevention and management. So you can alleviate the severity of allergy symptoms by avoiding or reducing exposure to them. There are a couple things that you can do, like trying to keep your windows closed, limiting outdoor activities, especially during peak pollen counts and windy days. Um, Paying attention to local weather reports of pollen counts can be helpful sometimes. And then also, if you remember a couple slides ago, things like ragweed, they are typically highest in the morning, while trees and grasses, the pollens that come from trees and grasses, peak in the early evening. So maybe trying to take a shower before bed to wash away any pollen residue that's on your hair or your skin. Trying to wear a mask when you're outdoors, that can help reduce the amount of pollen particles that you breathe in. Now, I realize that some of these may not be practical or always possible, but there are things to consider. And, if the situation arises where you could try some of these, see if they help or make a difference. But you also can talk to your doctor about if they recommend any prescription or over-the-counter medications to relieve any allergy symptoms. And that's actually what we're going to talk about next. So, of course, before starting any type of medications, you want to discuss with your physician. There are, for these ones, a lot of them have over-the-counter options as well as prescription. So we will start with antihistamines. These reduce or block symptoms that are caused by the chemical histamine. Most are available in non-prescription forms, including tablets and liquids and even nasal sprays. A common side effect would be they can cause drowsiness, so that's definitely something to be aware of. The next one is the nasal corticosteroids. These treat inflammation and reduce allergy symptoms, including nasal congestion. They are typically sprayed into the nose once or twice a day, and possible side effects could include stinging in the nose or nosebleeds. And these are available through prescription and over the counter. Next up is the decongestants. And these are drugs available by prescription and over the counter as well, available in oral and nasal spray forms. They're sometimes recommended in combination with other allergy medications for brief use. Although using decongestant nose sprays for more than a few days can sometimes give a rebound effect. So basically, your nasal congestion could get worse. So definitely talk with your doctor or your healthcare provider if using decongestants for more than 2 or 3 days. And then lastly here, immunotherapy. So these are air quotes allergy shots. They're a form of allergen immunotherapy in which your body responds to injected amounts of allergens given in gradually increasing dosages by developing a tolerance. And then some alternative treatments. There are non-drug alternatives available. Although these products may relieve some symptoms, they usually aren't able to completely replace medications. So it is important to be aware of possible side effects of both medications and non-drug alternatives. And as always, be sure to talk with your healthcare provider before starting anything new. So the first one here, nutrition. A couple different ideas to go along with that one would be, special diets. If you work with your doctor or a nutritionist, um, talking about specific diets, dietary supplements, herbs, or probiotics. Psychological, so meditation, hypnosis, relaxation therapies, physical, which would be things like acupuncture, massage, spinal manipulation, and then also natural/non-pharmaceutical treatments would include like saline nasal sprays or nasal irrigation. And sometimes a combination of these, such as psychological and physical, or the psychological and the nutritional. There's some evidence that supports the combination can be effective in combating seasonal allergies as well. So if anybody wants to share if they've tried any of these methods or if it's something that you're interested in, please feel free to add that to the chat as well. Okay, so medications for children. A little bit of information on the screen here, but some medications can be used in children as young as age 2. But ultimately, medical questions or medication questions, you can contact the numbers at the bottom there, and there's even an email that I can give you too. It's druginfo@fda.hhs.gov. And then for management, so as a lot of us know, this can be very frustrating, very unpleasant for a lot of the year, considering, what we learned is some of those things can start as early as February or March and go all the way through the fall. So it can be very frustrating for people. So you want to try and do everything that's, within your power to be able to manage them the best. So a couple tips here, staying hydrated. It's important for supporting your immune system in general, but especially during allergy season. Drinking water helps to thin the mucus, which can help relieve some of your congestion if that's a symptom that you're experiencing. Also, warm beverages such as like herbal tea can also provide some relief and help clear out some of your sinuses. The next one is maintain a clean environment. So to reduce allergens, thoroughly clean areas that get the most traffic in your house. So things like vacuuming often, washing and covering your pillows, trying to take your shoes off before you come in the house, maybe even investing in an air purifier with a HEPA filter. Those kinds of things can be helpful with trying to keep your environment clean. Boosting your immune system. So maintaining a strong immune system can help lessen your symptoms. So things like focusing on a balanced diet, having plenty of fruits and veggies and proteins, maybe trying some supplements such as vitamin C, vitamin D, or zinc. But of course, before starting any type of supplement, you'd want to talk with your doctor to see if there's any interactions with medications or any other concerns in that way. And then lastly here, managing stress. So whether you participate in stress relieving activities such as, things like yoga, meditation, deep breathing, or even if you just set aside a few minutes each day for yourself to do something that you enjoy, trying to make that time for yourself to manage your stress a little bit better, as well as trying to get enough sleep. That's essential for both maintaining your immune system as well as trying to manage your stress. Okay. And then just to wrap up here, some of the main takeaways are, knowing what your triggers are. So learning what kinds of pollens you're allergic to, and then taking precautions, whether that means trying to avoid being outside during, really windy days, or keeping your windows shut, or wearing a mask. Um, Getting support from your doctor and friends and family if possible, determining a treatment plan with your doctor, and then trying to manage those symptoms as best you can with, um, some of the things that we just talked about. If you want to take a screenshot of this barcode, you can. If you want to sign up for other programs, you can also go to the website, the wellness calendar, and sign up there. Here are the references for the information today, and then also some member services. Thank you.